You're listening to the Aesthetically Speaking podcast, presented by Nextech.
Hey guys, welcome back to the Aesthetically Speaking podcast. I'm your host, Tyler Terry. This is brought to you by Nextech, and we are here in beautiful San Diego. I think I've been to this conference 3 times now in San Diego over the last 11 or 12 years, and this is always my favorite location. I have 2 incredibly special guests here today. I have Dr. Fearmonti, who is from beautiful San Antonio, and I have one of my favorite plastic surgeons, someone who I consider one of my really, really good friends, Dr. Stanley Okoro from Marietta, Georgia.
Thank you, Tyler. It's nice to see you. I believe we probably met in this city. I'm
We
not sure.
did. It was actually my first ASPS was in 2013, and it was in San Diego. And yeah, Touch MD had a huge booth, and I remember that's the first time I met you.
That's probably correct. That's
Yes.
probably correct. Yes.
Yes. So how are you guys doing today?
We're doing great.
You can't be angry in San Diego.
Yeah,
You really can't. You really
Even
can't.
overcast days are better than sunny days in Texas.
Yeah.
It's true.
I ran into Gina at the talk. I'm like, oh, Gina, you're here. She's just a very fun person to be with.
So is Stanley.
So, Dr. Fearmonti, I'm going to let you answer this question first. But my first question is, how do you attract new non-surgical patients to your practice and keep them?
And keep them, yeah. The retention's always the kicker. I think, social media is such a big thing. Depending where and what time of day, people are always on their phones. I think authenticity is the way to attract. I don't say yes to every patient, and the patients in my office might be very different than the patients in Stanley's office or some of my colleagues in San Antonio. I think people kind of have to connect with you on some human level. They think you're funny. I'm a crazy dog lady. I have 3 Cavalier King Charles Spaniels, so I tend to attract always a little bit of dog hair on me, and my patients seem to get it.
Yeah.
So I think they, the personality, because you're engaging in a relationship with them, it's kind of a friendship, that lasts decades. I operate on them and their daughters and do their implant maintenance. And so it is a relationship. We have to like each other and bond on some kind of human level. So I think social media, Facebook, Instagram really kind of lets them connect with me. I get them in the office and, the magic happens.
Yeah.
And then I think retention's the same way. Do good work hard, make them happy, get inside their head and see what they want, and just, help them be the best version of themselves. And, we both win.
Wow. Authenticity is key. Find common ground. Relate to them.
Dog people.
Dog people. It's true.
Yes.
I have a dog too. We got a dog for Christmas, a little mini golden doodle that my girls can't get enough of. So that's amazing. I love that. Thank you for sharing that. Dr. Okoro, I'm going to turn the time over to you to share your thoughts on that.
On how to attract new non-surgical patients.
Yes.
I totally agree with what Gina said. For me, the majority of my non-surgical patients actually come from my surgical patients.
Okay.
Yeah, just like 2 days ago, little secret reveal. I just had my Botox done. Like,
It looks good.
It does look good.
Can you see that?
It does look good.
It was
Who's your
like-
injector?
My PA does I hired them so they could do I can't do it myself. So once they can do my Botox, but actually this actually Daxify actually.
Okay.
Yeah, I want Daxify because it kicks on a little faster. So I forgot I was coming here and some wrinkles and stuff. 2 days anyway. So we do a little video of her injecting me. We post it. And then my patients come to, let's say they had a tummy tuck or whatever. Like, hey, I said, were you getting Botox yesterday? I said, yeah, I was. And then, you can too. So I would not tell you how many times that has come up. And many patients that never thought about it, because they think Botox or Daxi will make them look like Hollywood, frozen and not talk. And people don't know that. Like, no, you could look like normal just without the wrinkles.
Yes.
So many of our patients come from our existing patients. So how many times can you have tummy tuck one time?
It's true.
Sometimes twice after pregnancy.
That's right.
Weight loss.
Yeah, but
Sometimes.
in general, most surgical stuff is once in a lifetime. So they convert to injectables and Botox is like keep coming back, and because you gotta keep looking good. So, but I totally agree with everything that Gina said. Social media is a big deal. I only do procedures on people I like. if I don't like you, we usually don't get along that well. Yeah, it really is. I mean, only, my patients are considered my friends.
Yeah.
So this way it is. I like Gina, so that's why we hang out.
Yeah, that's why we're on the podcast
I
together,
like
right?
and follow all of his posts too. I would pick Stanley as my doctor. I think he's funny
You too.
and meticulous in his technique.
Thank you. So, yeah, I think that's it. Everything Gina said plus our existing patients. Yeah.
So I love that they come in for a once-in-a-lifetime procedure, sometimes twice in a lifetime.
Yeah.
But then they become lifetime patients.
That's
That's
right.
amazing.
Yeah. Well, what is the value of a lifetime patient? Right?
Yes,
The lifetime value of a patient is different for different in the industries, right?
Mm-hmm.
Yeah. I think I've heard someone say, so it's a lot of money, so patients come in and they become friends. We talk about, I don't have any dogs like Gina does. I have 4 kids though.
You win.
And you can relate there.
Yeah. Yeah. So, talk about life and stuff. I have many patients, we go through life, kids. With the patients that have kids, we talk about kids.
Yeah.
I guess the dog people talk about dogs.
Yep. And then the ones that have dogs and kids talk about their dogs chasing their kids, or the kids chasing their dogs.
Dogs.
Yeah.
That's right.
But you do kind of treat like the whole family at some point because you meet them. They're like the caregivers.
Absolutely. I mean, many of my patients, I take care of their mom and their daughters and their husbands and of course their friends. It's like a tree.
I never thought of it like that. That is true.
It is true.
Because of the loyalty, I trust who my wife goes to.
That's right.
And then a lot of my friends trust who I go to.
That's
They're like,
right.
bro, I know that you, like at the gym, who do you go to, man? And I'm
Exactly.
like, well, I go to who my wife says is great.
Well, so social media is actually nothing new about social media. I would say social media has been out long time ago. Even the Bible has social media. It's called word of mouth.
Yeah.
That's what social media is.
It is.
Yeah, there was no Facebook back then, but
Yeah.
it's the same thing.
Well,
Wow.
good information disseminates quickly, but so does misinformation too.
Yeah, either way.
There's a lot of
Yeah.
unteaching or educating, I think, when we get patients like that sometimes because they come with like a notion of something and you're like, no, it's not quite like that. It's not quite like that.
So you're right. We spend a lot of time educating patients about anything. I mean, it's so funny what people don't even know what Botox is or what filler does. What the big questions? What's the difference between Botox and filler?
Yeah.
Like, there's a lot.
Yeah, it's a lot. But people think it's the same thing.
Yeah.
So it's
Like, can I get some filler up here?
exactly or some Botox right here.
My lips are thinning. I want Botox.
Botox, yeah. So, but I mean, they don't know. I mean, so there's a lot of misinformation they don't understand. So,
But that's a compliment that, like again, your friends at the gym, they don't know what you had done, but they're like, wow, like, what are you doing?
Yeah.
And they don't know because you don't look strange and unusual. You look just maybe a really good version of you that got a good night's sleep and is drinking your water.
Yeah.
And I think that's our compliment when they come in and they're like, oh, I saw Tyler's face. What's Tyler got going on? And we don't tell Tyler's secret.
Yeah.
no,
We
absolutely.
just look at the person in front of us.
Absolutely. I said they would notice, but they wouldn't know.
That's right. That's right.
Yeah.
Unless they put it on their own social media.
Ooh.
Hey, once they put it on social media, then we'll blow it up.
That's right. That's right.
Wow, I love that tagline. They will notice, but they won't know. I might write that. I'm gonna write that down. That was
it's a
that
good
was
one,
good.
An Okoroism right there.
Awesome.
Okay, you guys got to come back tomorrow for another podcast. This is fun. I love it. All right, so I'm going to go ahead and shift gears to our next question. And Dr. Okoro, we're going to start with you on this one. What do you wish patients knew before they came to see you?
I wish before they come see me, at least most of them actually do some research on us anyway.
Yeah.
Yeah. But maybe do a little more research on the procedures. A lot of times they spend time researching the technology. Like, let's say, smart lipo or something like that. They research instead of what they wanted to. So a lot of times we spend a lot of time with education and stuff like that. I wish they knew more of all of the, I mean, they can't know the limitations of the procedures that they're going to get. Because a lot of people come with all these unrealistic expectations and you have to like you're trying to educate them and walk back and they're like, are you sure? I saw my cousin did that stuff and she looks amazing. Like somebody comes in like they want a breast hug, but they need a breast lift. But my cousin just had a breast implant and she looks amazing. Well, your cousin's breast and your breast don't look the same. just because it look good on your cousin doesn't mean it's gonna look good on you. So those are the things. I mean, I wish patients came actually trusted their doctor. I think that's a big deal because now it's like there's no trust. There's no people don't trust their doctors anymore.
Really?
Yeah, they trust social media more than they trust their own doctors.
Wow.
Because they think social media is the truth. If it's social media, it's the truth. That's it.
Wow.
Yeah.
That's the first time I've heard that.
Yeah,
That's powerful.
I think most plastic
And I
surgeons,
believe it.
Most plastic surgeons will believe that. Word of mouth is a big deal. Yeah. They trust Google more than they trust their own doctor. And that's that. I wish it wasn't like that.
That's the truth. To answer, what do I wish they would maybe do ahead of time? They don't know about the recovery, bruising, swelling, downtime, and then maybe not just physical, but emotional and psychological impact of having perhaps a big procedure. I do a lot of body contouring after massive weight loss. So it's often more than one procedure, starting with maybe the abdomen, circumferential, belt lipectomy, arm lift, thigh lift. There's some downtime. I give very specific instructions. We show videos of bruising, we show incision location, and I give very specific post-op recovery instructions too. I agree with what you said to echo that. They, sometimes the recovery instructions, we have a reason we do things and they have it in writing and they still look online and their brothers, sisters, cousins, veterinarians, dogs, and had a faja, which is a compression garment.
Yeah,
I learned that. And I'm like, well, I don't use a garment. I didn't do liposuction on you. I think it rubs your incision, or like for an abdominoplasty, maybe it can cause some thickness to your incisions. Rubbing.
So I had a patient the other day. She's a nurse.
Mm-hmm.
She has some like breast implant. The breast lift. One of those wound at the T junction.
Yes, a little wound breakdown.
Yeah.
Mm-hmm. Super common.
Very common. Over 90% of patients may have it. So she went to the hospital where she works. One of the nurses told her that she should have a wound vac on it.
And that's a burdensome dressing that sucks. And it sucks and it sucks. That's a lot. If they would just call us, with little things, we're here to guide them. But again, understanding that it's a journey and there's going to be some downtime. And I say, you got to put the time in now so that we can get you back to the gym quicker. Don't go back to the gym day one.
Yeah, it's very, very interesting.
But the paint's still wet, and the paint's wet for a while. So don't leave a fingerprint in the paint. But it's not one and done. And I think with social media, there is a lot of with just a breast aug, like what is it? Fast recovery, rapid recovery breast aug. You're at the gym the next day. No, you're not.
No,
you're not at the gym the next day. No. I don't know. That's just misinformation.
And then just like what Gina said, the before and after actually is a deceiving marketing for the patients.
Yeah.
They think you just go in, you come out after. But I always tell my patients, the question you should be asking is what's in between the before and after. That's where the money is.
Yes.
Not the before and after, what's the in between?
Yes.
So
because you're setting the expectations, correct?
The in between, I said, this patient that you're seeing, this is like 3 months, 6 months after her surgery. This is what happened. We have slides in TouchMD for that, actually.
Oh, good.
Oh, yeah. So
it is a good, yes.
Yeah, we use TouchMD to show the photos. And so it's very important because if you do the breast aug or we're using breast aug, why don't we just use liposuction? But we just came with BBL talk.
Yeah, just a lecture about safety with Brazilian butt lift.
Exactly. So yeah, BBL, you have swelling, bruising, and stuff like that, right? Then you're not going to look like a before and after you just saw on my website. No, that's a time of healing.
Yeah.
People don't know that. I wish they knew that.
Yes. Yes.
And the in-between can make or break the result too, sadly enough.
Yeah, and what they do in between, a lot of times
they just see the little slider video on social. Like, that's it. When I walk out,
you walk out like that.
It's not a car wash,
exactly.
No, the spots are on. The spots are off.
It's true though.
What happens inside? There's lights and there's different color foam. There's a lot of magic.
Yeah, it's true.
Oh my God, car wash. I like the car wash analogy.
That's a very good analogy.
That's a Fearmontiism.
Yes, I like that.
I like the isms.
A car wash is okay.
That's my thing. Kind of my thing.
You two are amazing. I'm like, wait, we should do a podcast. We need to go start a podcast, the three of us. We can just do this.
I told you, Tyler. We could bring excitement to your stuff.
Awesome. You guys have a vibe. I love the vibe right here. And also I love the respect that you two have for each other and also the amount of and the level of professionalism that you take to what you do. So I know we're laughing at, we're having a good time, but you two are incredible at what you do, and it's important for patients to know that. So
Thank you.
Appreciate
all right.
that.
Of course. All right, Dr. Fearmonti, I'm going to point this question at you first, and then Dr. Okoro, I'll have you answer after. So if you weren't a plastic surgeon, Dr. Fearmonti, what would you do instead?
So great question. I think about this all the time. I would do nothing in medicine. I mean, going through medical school, this wasn't always the plan, but it became the plan very quick. Once I kind of, my pathway, we all have different pathways into plastic surgery, but, dealing with patients, post mastectomy, breast cancer reconstruction was just my passion very early on. I mean, I did in my past life a lot of the extirpative mastectomy surgeries, and I just thought putting it back together at the end was a lot more interesting and fun for me. It's just a different side of it, and that also has kind of just shaped my life. So if not plastics, nothing in medicine, actually. Well, I like decorating cakes and I like painting.
Ooh.
Acrylic paints. A lot of us have artistic sides. There's the science component, which is fascinating. The technology is fascinating. But, just the vision and, creating something just great or aesthetically pleasing. I think a lot of us do have a little bit of a knack for that. Walking around this meeting, some of these outfits that are put together and, the matching, this is a very artistic and scientific crowd. Like everyone,
Yes.
and Stanley always has flair with the bow tie.
It's true, the bow tie.
Like
Every
somebody
year since I
spent
first
time
met
on
you.
this. Yeah, this is
Yes.
not an accident. Is his dapper look. But I think, something like that requires a lot of fine detail.
Yes.
Working with my hands. But it was plastics or bust for me as far as med school.
I love
Wow,
that.
that's very, very interesting. I did not know about that in the Apache. Wow. For me, if I wasn't a plastic surgeon, I kind of, most plastic surgeon after 15, 20 years, you start thinking about what you're going to do next, right? So I love computers. I really love computers. And I love working on the website. If I wasn't a plastic surgeon, I probably would have owned my own IT company. I mean, right now, I write most of the pages of my website. I write them myself.
Wow.
Yeah, and I
That's unique.
I used to literally write a page a week or rewrite a page. I mean, I get bored on what was on the website. I just change it.
Well, it reflects your personality too. We talked about patients connecting with you.
Yeah.
I think when you look at your website, to be honest, you do get a feel for who you are.
Thank you. Wow.
That attracts.
So I just write it, and then so I go to on a page what would somebody want to know about this? Okay, well, the most important questions, and I use the questions that the patients ask in the exam room to write the website, because that's what the most common questions are the most common things that people want about.
Yeah, because you want them to be prepared and also get a feel for who you are and how, what differentiates you. I love that. All right. Well, I know we're out of time. I want to say thank you again for being on the show. For those of you that are listening, if you'd like to follow and connect with Dr. Fearmonti or Dr. Okoro, links to follow, subscribe, and connect with them will be in the show notes below. And until then, I hope you guys have a great rest of ASPS, and we'll talk soon.
Thank you, Tyler.
Thank you.
Thanks for listening to Aesthetically Speaking, the podcast where beauty meets business, presented by Nextech. Follow and subscribe on Apple, Spotify, YouTube, or wherever you like to listen to podcasts. Links to the resources mentioned on this podcast are available in your show notes. For more information about Nextech, visit nextech.com, or to learn more about TouchMD, go to touchmd.com. Aesthetically Speaking is a production of The Axis. THEAXIS.io.